From the studio of South Asia Views.
The World Health Organization on Saturday expressed concern amid a significant rise in corona cases worldwide. There has been a report increase of 8% of over 11 million COVID-19 cases globally, the world body said in a press conference. With countries like China, South Korea, UK and Hong Kong reporting worrying numbers despite a significant reduction of testing occurring worldwide. Whose COVID technical lead, Dr. Maria Van Kerkhove, said there were huge amounts of misinformation regarding COVID-19, which has added to the rise in the number of cases. The world body stated that it has been wrongly assumed that the pandemic is over and that this is the last variant or that there will be no more variants to deal with. All these have added to confusion and thus a surge in infection. We have huge amounts of misinformation that's out there. The misinformation that Omicron is mild, misinformation that pandemic is over, misinformation that this is the last variant that we'll have to deal with. This is really causing a lot of confusion, Dr. Maria Van Kerkhove said in a press conference. As per WHO, the Omicron variant is highly virulent, and with the emergence of new strains of the variant, the rise in the number of COVID-19 cases is a cause of concern. Other factors like lifting of mask mandate, lifting of restriction and the social distancing rules not being followed are also being pegged as a major contributors, giving rise to the significant jump in coronavirus cases.
And Omicron BA.1, it's been detected, but there are very low levels of this detection. The recombinant itself, this is something that is expected given a large amount of circulation, the intense amount of circulation that we saw with both Omicron and Delta. And given the sheer number of changes and mutations within Omicron, it was much easier for researchers, scientists, public health professionals, people who are studying the genome to be able to detect these recombinants. We have not seen any change in the epidemiology with this recombinant. We haven't seen any change in severity, but there are many studies that are underway. Unfortunately, we do expect to see recombinants because this is what viruses do. They change over time. WHO has been aware of this because of our Technical Advisory Group for Virus Evolution. So this is something that's on our radar. It's something that we are monitoring. So it's really critical that we have testing, and it's really critical that we continue with sequencing, that we have good geographic representation of sequencing around the world, and that the systems that have been put in place for surveillance, for testing, for sequencing, right now be reinforced. These are the systems that we have in place, and so we will update you on any new information that we have as soon as we have it.
From the studio of South Asia Views.